So this next part, I want to talk about finding your pelvic floor. So it sounds a little strange. And when we're in the clinic and we're working with someone, it might seem like I'm kind of flying through this stuff, because in the clinic we'll spend anywhere from 5 to 20 minutes of just one-on-one, me, the patient, and helping them find their pelvic floor, as creepy as that might sound. But what you're going to do is, if you find your ischial tuberosities, here's a picture. It's the bony part in your buttocks. So if you ever sit on your hands and you feel the bony part in your butt, those are your ischial tuberosities. So to find them, well, what you're going to do, once you have them, you slump back in your chair a little bit. Now you're going to be posterior behind those ischial tuberosities. If you start to sit up tall, get out here. So if you start to sit up tall, you're going to start coming over those ischial tuberosities. At that point, you're kind of on the top. You're going to hinge forward at your hips. It's tough to do in the chairs here, but if you hinge forward at your hips, it's going to put you anterior of your ischial tuberosities, and that puts you on your pelvic floor. The reason why I get so crazy about pelvic floor, it's part of your core, and everybody talks about, you got to get your core stronger, you got to get your core stronger. And if we can do something to get that pelvic floor to fire throughout your entire day, that's going to be great. That's perfect, because just by sitting, you can think of it as doing a core exercise, at least part of that core firing. If most times people will think core, abs, back muscle, and then you've got pelvic floor and diaphragm on top of that. So this gets a good chunk of that pelvic floor going. So then the last part is you get your upper half in an ideal position, and that's just what you did. You shrug up, turn out, come back down. So now, once I'm talking to a patient like this about this in the clinic, they kind of have like a glazed over look, and they're like, Jesus, it's going to take me 20 minutes to sit down every time at work. Like that's not really feasible. But the good news is, if we can get your dental stool adjusted the right way, then you don't even have to think about it. You just sit right down on it. Bam, you're on your pelvic floor. Posture begins at the pelvis is one of the phrases we like to use. And now you're going to be in a good position already. So it's not like a 45-minute process of like squiggling around in your chair while your patient's looking at you funny. So there are a lot of different stools out there. This is just one example. Some people love it. Some people hate it. I've had some people where they can't stand a saddle chair because they feel like they're going to slide right off. I know some people really like it. But my big things, come back here. So my big thing with the stool is if it can go up and down, and if that seat pan can tip forward and back. Because when it raises, if you raise it up, you want your hips a little bit higher than your knees, and you want, with the seat pan, it just lets you get on your pelvic floor. So those are the two big things. With the seat back, it can give you a little bit added support as well, which can be a nice feature.